Hi guys, what's up everybody? Welcome back to GegoBase Prittyvishy fans. Tufikisheni Gego Care 1000 subscribers. Sindio, at least support apakule one touch. So guys, beside me, on my right, on my left, these are my dentists. When you semanga Pritu mekwa mawaya mafence. Hawa ndo wanaeka hizo mawaya na mafence. And guys, mkijua hizo mawaya na mafence, where zinasaidia. Kuna tumekuwa kiniambia Pritty, we can see a very huge improvement on your teeth and all. Guys, these are the people that are making it happen. Yeah.
But we don't say.
Yeah.
We don't say.
Yeah. Now the topic of today ni about consultation. Kuna ma clients wanaambiwanga consultation is this amount of money. Unakuwa like, hey, bora consultation expensive hivyo na kuongea tu. Nakuja tu tunaongea na like tunamaliza na happen. So I want them to answer it in a very deep way, because that mimi shwari sini kuongea tu, mimi nakuja na doctor nasikia mimi na nyuma tuingie ningoe chonde wazi juu kama umenioa kama nimeenda tena nalipa consultation.
Yeah, who are your fans? Who are you talking to bwana?
I am talking to my fans, you know. Lazima tujue, lazima pia mimi nijue.
Nipate menisumbua kuongea tu.
Kuongea tu.
Mimi hata mimi on my side mimi nataka tu kuongea na kuja naambiwa Pritty, so wewe tunafanya hivi na hivi, then tunafanya kama kufanya mali nenda narudi.
Sasa swali ya kwanza basi, si ungeongea na huyo jamaa amekuleta bus driver, mungeongea tu akuambie tutafanya hivi. Where did you come to me? That is the question. See, that is what we are. You asked a question. That is our response. Anyway, I think let me take this first. Head on. Consultation, yes, ni kuongea tu.
You haven't even introduced yourself. Watashangaa Dr. nani?
Sisi tulishasema si celebrities.
Celebrities. Hatukuwa wewe acha bwana.
We are here promoting you, not the other way around. My friend. Okay. Mmesahau. Ni Brayo.
Philip.
You are happy?
Na wewe pia introduce maselebu wote. Fiti.
Sawa bas. So now that is out of the way, consultation ni kuongea tu. Okay, ni ukweli, lakini si ukweli because it has several parts. There is the kuongea part, there is the clinical examination part, and then there is the investigations part. Okay, so you start with explaining your problem. So in my opinion and experience, consultation is the single most important part of this whole process, because that is the point where we establish what the problem is. You have come with pain, sio? They are usually, of course, client akikuja anasemanga tu naumwa na hii side, sijakula na hii side for this period of time. So what do? We ask follow-up questions, because there are some things we need to rule out. I need to find out whether it's an infection, whether ulipigwa mangumi jana, you have a fracture of your tooth, or such things. So I ask follow-up questions. It leads me in a certain direction. Okay, so after that, then we have to establish exactly what the problem is. So I go and check clinically. Naangalia kila jino, tooth by tooth, because the accuracy of this diagnosis is what will give us the treatment that you need. And so that is why we have to be thorough. And it's actually sometimes even longer than the procedure itself. I mean, a root canal, the first stage could even take 20 minutes. Okay, but the process of consulting could take up to an hour. Imagine after all that, I'm going to maybe do an X-ray, okay? And then now we sit down and discuss it. Now that is where I will introduce, I explain to you in detail what your problem is. I have understood your problem. Now I explain it to you, because we need to make decisions together. Kuna kitu tunaitanga autonomy, patient's autonomy. So autonomy means you are in charge of your treatment, not me. You are in charge of your treatment. So for me, I will explain everything from the problem and the options in terms of solution and the various costs. Treatment usually kuna options. Kama ni meno inauma, we can either extract or do a root canal. See? You will ask me for cost, I'll tell you extracting is cheaper, but in the long run it's more expensive because you need to replace blah blah blah. So you get all the pictures, then you now decide. So at the end of the day, the decision lies with you. Okay? It lies with you. For me ni kukupatia all the information surrounding your problem, all the solutions, all the costs, because costs are important. Hata hiyo swali ni poa because cost is a concern for everyone.
Yes.
For everyone, for everything, because kwanza na hiyo uchumi sahi mambo ni tricky kidogo. I mean pesa badala
So venye mimi nimeelewa consultation ni plus check up.
Yes, consultation for us, for us as dentists, it involves talking and then examining. So tukishaongea, we'll sit down here, I will open all these instruments of mine and then check. I will check each and every tooth. I will check all your soft tissues, the gums, the cheeks, the throat, uko mahali naeza ona. You understand? We sometimes use some those tablets.
Or
disclosing tablets to check where uchafu ziko, such areas, and then now we give you a full. So you will actually come with one problem, then I'll tell you all the other problems that you have. That is the part. So consultation is not about that one thing you want. It's everything that you need. Mona. So anytime somebody tells you that consultation is expensive, kwanza kana yeye chini mwambie in fact it's very cheap. It's very cheap. It should actually be the most costly part of the treatment. Okay? So that it entails everything, baka diagnosis. I mean, sasa hizo investigations, radiographs, study models. So that by the time unatoka hapa, you can even see your mouth ndio hii. Ndio hii cavity, ndio hii gum imerecede.
In 3D.
In 3D.
Well, mimi najiona tu mtakuja naongea kimaliza unaenda nyumbani, but I think kwa vitu nimeshika, I think consultation has to be more expensive than the treatment.
Yes, it should be.
It should be. Ideally.
Ideally, we should charge you a lot of money to get the correct diagnosis. Diagnosis is everything. If I don't have a diagnosis, then what am I treating? If you don't understand the diagnosis, then what are you being treated for? Alafu you won't even understand the treatment plan.
True.
Alafu the plan is also according to, we look at many factors. We look at emergencies, so the emergent issues, you're in pain, we sort that out fast. So kama finances is a problem, we spread out the treatment for you. Because some things are not urgent, some are urgent. So you can also plan yourself. We can schedule peer according to your availability. There's a lot that goes into that, because the planning is what is important.
Dr. Philly.
Niambeni.
Me just know mwakazi.
Mwakazi,
Dr. Philly. Mimi, like for example, nimekuwa na, let me just talk about teeth. Nimekuwa na wasenga nasema naumwa na meno but sitaki ende ngolewe. Sijui anasema sijui afanywe inatonga nini?
Root canal ama filling.
Yeah, alafu pia kuna that one is ninakwanga na question mark like how mimi najuanga dawa ya meno ni kuingoa.
Okay.
Then the other thing ni unapata for example mimi niko na gap huko mwisho, mtu anasema mimi sitaki niendelee kwa na gap, nataka niekwe inatonga aje ukiangalia na kama meno inaonga meno.
Si ni meno but sasa ni artificial
dentures.
So
na ukikula nyama wangi natingi kama inatikini kabisa.
Now let me answer that, okay? Now that's why I will go back to where the doctor was explaining, okay? When you come, okay, kama tuanze na hiyo story ya jino la kuuma, si ndio? A tooth is painful, okay? We must examine the tooth, okay? Is it restorable? Okay, ideally we don't love, as dentists we don't love losing teeth. We say ile Mungu aliyotupatia is actually the best. Okay, so we like maintaining what the natural, or preserving the natural, if you can use that term. Okay, so now when you come, after I've done my clinical examination, I already have what we call a 80 to 90% chance I know where we are heading to. Okay, the X-ray is just confirmatory. Okay, to confirm I know this tooth can be saved, this tooth cannot be saved. Okay,
maybe extent your damage,
exactly,
other tissue.
Now back to the what, how will I actually handle you now. I will tell you, yes, this tooth can be saved. Okay, it requires it can be done for a root canal. Okay, but also remember, an extraction is an option. But remember, we talked about patient autonomy. Okay, I will explain all modalities. Nikwambie, there is root canal, there is extraction. Extraction later will be followed up by replacement if need be. Okay, now it is you now to decide which one you prefer, but definitely I will guide you. Okay, that's why we hold that one out. I'll tell you no, give it a chance. Okay, why root canal? Root canal, imagine you're given a tooth longevity, you're given it a second chance. Okay, root canal, let's do stage 1. You tell me how was your experience. Jino ili tulia, nikwambie sawa, let's go ahead tumalize stage 2, stage 3, tuijaze ubaki na jino kwa mdomo. Okay, all that is in that consultation. Remember, you mnasema tu ni kuongea tu, I have to convince you and guide you. Okay, now talking of spaces, okay, there's something here said. Okay, how is this space evaluated? Okay, definitely it's called a study model. Okay, unasema kuna mwanya huku nyuma, we take an impression, I assess that space. Okay, how will I close it?
Tulipima when we were starting braces.
Ile ugali
ukauma ukaanza kusikia
fani, unakumbuka tukakachomoa.
Then we went and made some models.
Yes.
I think
niliona samples.
Ziko nyingi sana. Okay,
yes.
Now you come and tell us you want this space closure. Okay, sawa, nimeangalia this is space, it's natural spacing, ama maybe you lost a tooth some time back. Then I'll give a solution. In many cases, if it is natural spacing, we do prefer braces. Isn't it, doctor?
Yeah, braces are best.
Braces are better, but if you lost a tooth, okay, ideally it is replace that tooth. Nanipata. So all this, remember, it's still part of the consultation package. Okay, it's still part of hiyo kuongea tunasema. Hiyo analysis yote is done during that part. Okay, now going forward, okay, I think there's an aspect that we need daktari to, which we usually handle during consultation. Okay, the patient's attitude, the patient's know-how, misconceptions are konazo, even the way they present themselves, some are usually anxious. Okay, so daktari has handled the technical bit. Unaona atakuelezea maybe fill-in, root canal, crown, name them, braces, etc. But there's also, it is still goes hand in hand with the technical, but it's mostly an interaction way. When you walk in,
knowing your patient, knowing the doctor, that kind of rapport and relationship.
When you walk in, okay, how you present, are you in pain? Okay, are you anxious? Do you have fear? Are you apprehensive? Okay, all that must be handled at even before we get to the chair side. On the seat, ukishaka hapa to have a discussion kando ya kiti tu ya daktari, we will talk it out. Okay, uniambie daktari, wanaogopa madaktari wa meno sana, nikuulize kwa nini? Just simple rapport, nikuulize why is it so? Okay, unaniambia I may have had a previous traumatic experience.
Kwambia ni painless.
Unaona, ama pain free. Whichever term we use. Okay, we handle such worries that you do have. Mind you, again, part of consultation at GegoCare, we have a form that the patient fills. If you have an allergy, you must indicate. If you have maybe a chronic illness, you must indicate. You must have what we call comorbidities. Kuna magonjwa mengine tu hapa na pale that may lead us affect treatment plan. Do you know there's some patients who may walk into us, okay, walk into our clinic, okay, they need maybe an extraction. True, it's an extraction, but maybe they have heart conditions, bleeding disorders, unmanaged blood sugars. You know, in this time, I may need to just refer you first to a physician before you come back to me. You know that all that is in consultation. Okay, so even before you come, your history, personal history, maybe we even have special needs, isn't it?
Special needs.
A child may walk in, and then for me it's just a child, okay, but as a parent or a guardian you're saying to me, so this is my child XYZ, he or she has this condition. Oh, so that will raise a hey, that when I'm handling this patient, I should avoid 1, 2, 3 things. Okay, there are patients here who come. Let me give you an example. Okay, which is very common. A condition like epilepsy. In our dental setup, we have so many lights. Some are triggered by the light, triggered by light. So when I'm handling such a patient, I should be careful, isn't it? It's such a small thing that I can ignore, but may affect my treatment. Many pattern, okay? So when you walk in, there are lots of things we actually put in charge, okay? Number 2, even body language. By now, pretty. Unajua mtu akuja akiwa mlevu, unaweza jua? I think you can know. Sindio? If someone walks in staggering, sindio? Yeah. Don't you think the patient is going to be apprehensive for in case? And I have to, no? Yeah, you pick all that during consultation. Remember, there's nothing really technical. Consultation. Someone has walked in drunk or high, intoxicated, name it, okay? Will you think it's available to handle such a patient? Will you be comfortable handling such a patient?
How do you inject anesthesia in that scenario?
Exactly.
Plus, anesthesia won't even work.
Exactly.
That's an example of, you know.
Alafu nikuulize hata mwenyewe ukimwelezea treatment plan, do you think akiwa soma ama atakumbuka?
Na sayo anafaa kusainiwa form because it's consent.
It's consent. Unaona? All this, bear in mind, is just part of consultation, okay? Now, let's now do the scenario, okay? Cost. Daktari talked about cost, okay? You will come to me, we have done a consultation, and later on treatment plan, which we'll discuss in the next episode. Remember, I will try as much to convince you to have a certain treatment which is advisable. Many times I think the challenge in inakuanga hapo kwa cost. Some procedures are much cheaper and faster. Like extraction is much definitely cheaper compared to maybe filling a root canal. Okay, but at this case you are a best candidate for root canal. Jino linakuma, root canal will salvage this tooth. Okay, but unataka ing'olewa, I'll tell you, listen. Okay. This is the full cost, okay? We at GegoCare, we do approve of a certain percentage of the full fee to start, okay? And then we tell you the residual balance, tunalipa pole pole, okay? You pay it in installments ikikuja pole pole. Because mind you, yes, huna hiyo pesa sahihi, lakini maisha kesho utakuwa nayo, isn't it? So you deserve the best treatment at any point in time, regardless of your financial situation. Okay. Unaona? All this established, remember what? In this period of consultation and examination. Okay? Utaelewana kabla tuanze kuchimba ama kung'oa hilo jino. Na nipata sasa. Okay? That's it. Finally, I usually discuss this and I usually tell my patients, it's good to create a rapport with your doctor. Yeah, baseline. Unaona hii period umekuja consultation and examination, create a rapport. Talk to your doctor. I think we are very open daktari, okay? Discuss. If you have any belief, any myth, any question, any query, ask. Tutakujibu during this period in time and we'll even explain to you the technicalities of each and every procedure that we do.